Hey everyone, Dr. Eric here from Med Better Health. Now, I want to tell you a quick story. I remember a situation where there were children who were taking care of a person living with dementia. And what happened was, it's very difficult to have difficult conversations. So when their father was kind of okay-ish, right, healthy, no one really had deep conversation among themselves about, well, if this happens to dad, what are we going to do? If this happens to dad, what are we going to do? And I remember the dad got really, really sick towards the end, and there were about 5 siblings, and all of them had different opinions of what needs to be done. And that's where World War III started. One person said, well, dad wouldn't have wanted to be intubated or resuscitated. The other person said, no, I spoke to dad. He said he wanted to be resuscitated. The other person said, well, no, we have to speak to our rabbi about it first before we make a decision, right? And there was so much fighting in between the family about every single aspect. So I always say to family members, to care partners and caregivers, if you're listening, this is my famous line that I tell everybody. It's better to have difficult conversations than to be in difficult situations. All right, let that sink in. It's better to have difficult conversation now, because it's a difficult conversation, rather to be in a difficult situation. Because those are two different things, right? So let's go through some family conflict in dementia care, because those of you listening right now, I'm sure that you have, if not all of these, some of these may be relatable. And let's talk about how you can overcome these and what you could do. You ready? Let's go. So dementia care conflict is a statistical norm, actually. If you look at the data, 40% of families experience significant conflict over dementia care decisions. That's 4 out of 10 that we know of. To be honest, my personal opinion, I think it's more 6 out of 10. But we have statistics here, 40%. Okay, the ripple effect. Conflict frequently delays critical care transitions, right? Because when everyone's analyzing and everyone's arguing, what happens? There are delays in care transitions, leading directly to elevated hospitalization risks. Well, we should wait. Mom didn't want that. No, let's not take him to the hospital. No, let's not do that. And then by the time you're done making a decision, someone's really, really sick because there's no consensus. Now, disagreement drives a downward cascade of risk. Let's go through this together. Lack of family consensus. What does it lead to? Delayed home safety modifications. Mom is walking around. Mom is kind of declining, and she is not interested in using a walker, right? You've had physical therapy there, and physical therapy says, hey, mom really needs a walker. She's high risk of fall. One brother says, we should probably listen to the physical therapist. The mom says, no, I don't want it. The other brother says, look, she's okay. There's nothing wrong with her. The physical therapy just wants to generate revenue and give us advice, but mom is okay. Conflict, right? Not a single decision. What happens? Mom falls down. Poor outcome for the patient, increased hospitalization. Let's look at another case. Postponed driving cessation. And by the way, if we made an incredible video about driving and safety in dementia. If you're interested and you're watching on YouTube, click right over here, the pop-up that's going to pop up on your screen. So, postponed driving cessation. A family, 3 siblings, dad still driving. One says, I drove with dad, he's completely okay. The other one says, look, I'm telling you, I'm noticing there's scratches on the car. He's getting lost along the way. You don't know what you're talking about. You're always overprotective of dad. That's the reason he's getting so sick, is because you're babying him. Leave him alone. Right? Conflict between family members. What happens? Dad gets into the car. Boom. God forbid, huge accident. Harm to self and potentially to others involved. And refusal of respite care. You're a caregiver, there's 2 or 3 of you. One of you is really taking care of mom and dad. The other 2 are busy doing their own thing. And then the one who's taking care is like, no, I got it. No, I don't need respite. I don't need relief. I'm okay. Just, let's see what happens. And then what happens? The actual caregiver gets sick as well. And if the caregiver gets sick, right, I always say this, when you're in an airplane and you're flying and there's some turbulence and some kind of emergency and the masks come down, what do the flight attendants always tell you? Make sure to put the mask on yourself first before you put it on your little kid. Why? Because if you don't take care of yourself and you don't save yourself, you won't be able to save your child. Same thing with dementia care. If you're a caregiver and you're not putting on a mask on yourself and you're declining respite care, you get sick, things go bad for you. That means you can't take care of who? Your person living with dementia. Okay, moving on over here. That delayed consensus misses critical intervention windows. Here is a huge one. And honestly, this is one of the most important things that you're going to hear in this video. And it's about establishing power of attorney and advance directives. Now, if you think about it, it's better to have difficult conversations now than to be in difficult situations tomorrow. Why? You've never had that difficult conversation with your siblings and with your mom and dad about, God forbid, if something happens to you, who do you want to make decisions on your behalf, right? Power of attorney, healthcare proxy. I know you're fine now, Mom. I know you're fine now, Dad. But God forbid, after 120 years, if something happens, which one of us, and it's okay, like you can think, or maybe one could be your healthcare proxy, the other one could be your power of attorney, but who? That's an important question, right? So that tomorrow, if that does happen to Mom and Dad and they're unable to make a decision, one sister and brother and the other are not fighting and the family member saying, I want to say what happens. There's an agreement, there's a consensus. Mom said, Dad said they want me, Harry, to be in charge as a healthcare proxy. I make the decisions respectfully. I will obviously take your input because we're family, but at the end of the day, Mom trusted me with that decision. That's an important, difficult conversation to have, because then when the difficult situation happens, what happens? Everyone knows Harry's got it. Mom wanted Harry to get it, right? Step one. Number two, advance directives, right? Hey, Mom, God forbid after 120 years your heart stops, you're not able to breathe. Do you want someone to press on your chest? Do you want someone to put in a tube? Is like, hey, that's life-saving, or maybe you don't want it. Are there circumstances when you do want it and don't want it? Let's go talk to your doctor about it. It's called advance directives, right? And so it's a goals of care conversation. It's better to have that conversation now than when it happens. Why? God forbid it happens, Mom's at home, she collapses, 911 comes, Mom is intubated, resuscitated, and then everyone's like, I don't know, she didn't want that. Wow. Yeah, let's extubate. Let's take the tube out. Yeah, let's not treat. No, we should treat. You're going to kill Mom. Well, she's already living right now. She has the tube in, and you're making the decision to take it out. What are you talking about? That's a difficult, it gives me chills thinking about it because I've seen it multiple times as a doctor. So you want to have this conversation early, right? Driving cessation. In dementia, you want to have that early and middle stage conversation, right? And then transition to specialized memory care. You know that may happen. You may not have the means to take care of Mom at home. So if Mom is already diagnosed with dementia, over here, you know that this is going to come. You start having these conversations around this area where you're like, look, Mom, if it happens that you're unable to feed for yourself, you have complete memory decline, where do you want to be? Are you comfortable being in an assisted living? Who do you want to be with? You have those conversations early on. Very, very important, right? Because delayed action directly compromises physical safety, and unified family decisions are an ethical, essential way to ensure timely actions before cognitive capacity is lost. Because from here to here, then you need to requires a legal capacity and unified family support. Once the person goes from middle stage to late stage, you have to say, can they make decisions on their own? So it's always better to have these conversations early on. Okay, low health literacy exacerbates systemic gridlock. Families with lower health literacy and limited access to professional dementia care, what happens is they usually tend to have a lot more problems and situations arise. So I'm gonna say things like this. Look, Medicare has been going in the right direction. I'm so proud of the work that my organization, Med Better Health, has been doing with Medicare. We've been selected to be part of an incredible program called the GUIDE model, Guiding an Improved Dementia Experience. Who is this for and what does it do? Well, it's for caregivers just like you who are exhausted, who may need these difficult conversations, who may need someone to hold their hand and go through these steps. Medicare now covers this. You get your own care navigator. Think about it like a concierge person who you can call and they will, who is an expert, and they will walk you through each and every step of this process. Number two, if you're a caregiver and you're exhausted and you just need a break, we talked about respite, you need relief, and you're like, man, I just wish I had some time to breathe. I just wish we can go to the restaurant with my husband and I can know that someone's with mom and mom's okay and I can get 4 or 8 hours of just a mental break because I know that 30% of caregivers have depression. I know that 66% of caregivers themselves have chronic diseases. I wish I had like 4 to 8 hours to go to a doctor's appointment. Who can sit with mom while I'm gone because I feel uncomfortable leaving her alone? Now Medicare pays for you to be able to do that. And it pays a home care agency. They come in and they watch mom and you can go and take care of yourself and put the mask on yourself. If you're interested in learning about this free program, there's no cost, you don't change your doctor, you don't change your insurance, everything stays the same. I want you to do a couple of things. Number one, you can go to this website that you see on your screen. You can click the QR code right over here, or you can scan it with your phone. On the bottom, inside the description, there's also a link. The link, if you click on it, has a 5-minute video. The video very simply describes the guide model, showing how you can get relief. There's a small, like 4 or 5 questions that you answer. You submit it to us. We reach out to you and we help you have these difficult conversations so that you don't need to be in a difficult situation. I'll talk to you in the next video.